In this tutorial, we're going to be looking at the 3 most common movements / postures that can cause lower back pain. We're going to start with the most common, which is spine flexion, and we're going to explore some movements, postures, positions that can help create lower back pain. Then we're going to move into twisting and explore some of the mechanisms and what it's doing to the disc. And then finally, we're going to look at spinal extension. When we're talking about spinal flexion, what we're talking about is this position, and we're mainly focusing on the lumbar spine because that's where the disc herniations or bulges are most likely to happen, mainly in the S1, L5, L5, L4 type segment. They can obviously happen higher up, but those again are the most common. So when we're talking about movements, we could be talking about repetitive movements, so constantly picking up, so on and so forth. It could be that we're constantly in this position, so we're down doing something in that position. Or it could be just one big heavy weight where we come into position, we flex the spine, and then we go to lift. Now, with all of those, the biggest sort of factor in that, yes, is the spinal flexion, but what else is important is the load that's on it. Now, this is a 20 kilo kettlebell. I'm not going to pick that up with a flex spine as I've just demonstrated. I didn't actually pick it up when I did it, but the load can help progress the problem or speed the problem up, because there are a few factors that come along with lifting. Because I know a lot of people will talk about spinal flexion. Your spine can bend, your spine is meant to bend, so on and so forth. And yes, it can do that, and yes, it is meant to do that, but there are certain situations where it's meant to do that, and there are certain situations when it's not meant to do that, plus some of the factors that we're going to talk about in a second. So when we are lifting, again, what we want is that hip hinge, we want that neutral spine. That just sets the spine in position. And then when we go down to lift, we're then in a much stronger position to lift the weight. What we, again, as I've mentioned, what we don't want to be doing, which is that flexion posture, putting it under load, that's what's going to cause the problem. And some of the factors that affect it, we're going to talk about in a second. The first factor that affects back injuries or disc herniations, disc bulges, is the disc size and the disc shape. Now, there's 2 essential shapes, which is an oval shape or an ovoid shape, and a limacon shape, which is shaped like a sort of kidney bean or a limacon bean, if you will. Now, the one that's more susceptible specifically in this flexion posture and this bending mechanism is a larger limacon shape. We'll talk more about the oval shape when we talk about twisting, but for now, the larger limacon type shape is the one that can't really cope with the flexion and extension of the spine. Now, with that said, there's not a lot you can do about that unless you know what shape or size your disc is. And without that information, in some respects, what I've just said is kind of irrelevant. The most important bit is getting into that position, because whether you're oval, big or small, limacon, big or small, that is the one that spreads the stresses most evenly around, and it's going to be the safest possible position. Factor number 2 is the straw that broke the camel's back. So it's these sort of fatiguing mechanisms. So as I've mentioned, there are the different ones. So we're constantly over in this position. We are bending over repeatedly, picking stuff up without much load, or you've then got the final one where there's a lot of load and we go down, we flex the spine and we pick it up. So we've got those different mechanisms. Now, the straw that broke the camel's back is the fatiguing one, so we'd be talking more about the first 2. Now, what will happen is not necessarily during an exercise routine, but over a period of weeks, months, possibly years, is those stresses will build up, and that fatigue will build up, and then it will hit a tipping point and the back will go. So it's not this one movement that I do that's going to cause the problem, but it's those poor movement habits over time that's going to cause the problem. So again, if we can clean up those movement habits, what we're going to be doing is, in a sense, we're saving the spine, we're spreading the stresses around the spine, and we're not creating that fatigue to the spine. So when we go into a position, we've got much more margin for error because we've kept all those fatiguing mechanisms, those stress and in a sense braking mechanisms, we've kept them at bay. So when we then do go out of position, we've got greater margin for error to be able to do it. And then finally, the bending direction. Now, this is a contributing factor, and all it really tells us is where the herniation is going to take place. So if I was bending straight forwards, then there's a good chance that it's going to come straight out the back. If I'm bending forwards and to the left, it's going to go out from the back to the right. Obviously, on the other side, it's going to go off the other side of the disc. So those are the three contributing factors to disc herniation in flexion. Movement number 2 is twisting of the spine. So this could be with a cable machine and I'm twisting the spine through, because again, this is where I'm using the load. And that's important because if I'm just stood here and I turn, then obviously the load is very low, so that's not going to be compromising my spine as much as if I've got a heavy weight on here and I'm really pulling it down and twisting my spine. It could be another exercise where some people sit on the floor, they've kind of got medicine ball and they go from side to side with that medicine ball. That would again be a damaging movement or exercise because we've got that load there of the medicine ball. Or again with the cable, if we're just going straight across or up, anything that's twisting under load is going to be causing what's called delamination to the spine. And the delamination is essentially, if you could imagine the disc, you've got the fluid in the middle and then you've got all these rings on the outside. What basically happens is they're tightly packed and that all starts to loosen, and then what can happen is the fluid on the inside or the gel on the inside can start to work its way through these slack or loosened rings that in a sense hold it in position. We then come on to the disc shape and size. Now we've talked about the two shapes, you've got the oval and the limacon shape. Now with regards to twisting, the more vulnerable spine shape and size is the oval shape, and it's smaller. So again, in some respects it's kind of useless information because unless you know what shape of disc you've got, then it's not going to necessarily be that useful to you. But again, what we need to think about is correcting that movement habit. So what we're not doing is using the load and twisting the spine. What we're doing is we're maintaining the position of the spine and we're taking the twist and we're getting that rotation from the hip and from the shoulder. So I'm able to rotate my whole body, but I'm not turning the spine, which is going to delaminate the disc. What it's also doing is it's, in some respects, it's removing the strength and the stability from those rings. So as I mentioned, they're all nice and tightly packed. What happens is they sort of loosen and slacken, so that strength and that stability that's within the disc is being reduced, which again is allowing the material to move through it and then create problems, if you want to call them that, bulges, herniations, or disc problems, disc pathologies in some way, shape or form. And then finally, as I've mentioned already, the load affects the amount of damage. So if we're using a higher load, it's going to create more damage and do that faster. So again, if I'm, loading this up nice and heavy, really dragging that down, but really sort of pulling down with the spine, or if I've got it here and I'm really turning, I've got to put a lot of effort because there's a lot of weight, then it's going to be creating more damage and faster. Again, as I mentioned right at the very start, if I'm just turning and reaching to get something across the desk where there's very minimal load on the spine, or if I'm stood up and I'm just turning to grab a coat off a coat hanger or something like that, again, there is minimal load on the spine. But what also comes with that is the movement habits that we have over the weeks, the months and the years. If we've been doing poor movement for weeks, months and years, then yes, that rotation there could, because of the fatigue and the minimal margin of error that I've got within my spine, that small movement could cause a problem. But if I'm using good practices, good movements, good postures, good positions, good sensible loads, rotating from the hip, rotating from the shoulder, what I'm doing is I'm saving my spine, keeping that margin for error, so when I then go and reach across to grab the coat off the hanger, it doesn't cause a problem, because most of the time I'm doing the right thing and then only very often do I just turn and rotate. So you can start to see some context, some nuance in the different types of movement and if they're creating a problem or not. The final movement is spinal extension. Now, I'm going to go down onto the floor and talk about an exercise. We've got the back extension, so we're in this position and then we're extending up. Or you've got the rehabilitation movement, which is extending up like so. Now, again, those movements aren't necessarily creating a disc bulge at the back, but as I've mentioned with regards to the rehabilitation, there is a protocol out there that uses that sort of position where you push your chest up off the floor. And what it's trying to do, first of all, you're using the gravity to sink it back down. Then you're using the extension to compress that top part of the vertebra or the back part of the vertebra to push the fluid back down. Now, what we understand is that, first of all, you need 70% of the disc height, first of all, for that exercise to be effective. If that's not there, then it's not really doing what it's saying it can do. The second thing with that is at the back of the disc, you've got facet joints that go between the spinous processes, and what you're essentially doing is you're crushing those together. So if you have got the disc height, and that is effective at helping the disc material go back into the spine, what you could then be doing is crushing the facet joints. So again, there's a trade-off there. There's the checks and balances there. So again, it all comes back to using those correct postures, correct positions, correct loads. If we're talking about doing the extending the spine, what we can do is not go into such an extreme position. So as I mentioned, I was pushing myself up off the floor, like in that exercise protocol. What you can do that's a lot more effective is just go into this position or this position. And then what that's doing, that's giving you a little bit of hydraulic pressure and pushing it back down, but it's not at the extreme end where the facet joints are going to essentially be caused too much of a problem. So when it comes to spine problems, we've talked about the discs, but we've also got to talk about the facet joints when we go into those extension postures that can be causing a problem. So it kind of then goes back to what I was talking about at the start, which is thinking about that neutral posture. So using that neutral posture under load, using that neutral posture to build a margin of error. So when we go out into poor postures, we've got that margin of error so we can do it. But most of the time we need to be using the proper postures, rotating from the shoulders, rotating from the hips, flexing from the hips, and in some respects extending from the hips and not the spine. Because if we do flexion, twisting and extension from the spine, we're going to cause a problem, whereas we are much more effective at using the hips and the shoulders for all three of them. So hopefully this is helpful, hopefully give you a little bit of insight into injury mechanisms of the spine. My name's Chris from Chris Fold Training. I'll speak to you in the next tutorial.